Okay.
So I'd like to welcome Bob. Is that how we refer to you, from School of Computer Science, and he's going to talk to us today about data visualization. Thank you.
Can everybody see the screen on Teams?
Shall I just go on Teams on my phone? I can let you know what I can see.
Hopefully they can hear you, is it?
They did it, they called 2 minutes ago.
Just let me go outside and double check that all is okay.
Sure. Sure.
It looks okay to me.
Oh,
Okay,
Oh,
okay,
yeah,
good,
that's it.
good.
Oh yeah, we have got the red square.
Okay, good, good.
red square.
The red square.
So I guess I'd like to start off just by saying thank you for the invitation to come here. It wasn't quite a long wait. I think 6 months or something like that. I guess I'll try to introduce myself since nobody here knows who I am. I'm in the School of Computer Science. I joined in 2020, and my specialization is data visualization. So, yeah. And the title of this talk is called Interactive Visualization for Health, especially targeted, hopefully, so on a topic that this audience can be interested in. So, what are some of the challenges when we're visualizing health data? So hopefully everybody here is familiar with these kinds of challenges, trying to visualize millions or billions of electronic health records. So that's one of the projects we're working on, is visualization of electronic health records. And the depiction of high dimensional data, so data with several characteristics, right? And events over time, say millions or billions of events over time. Trying to process and visually understand natural language text is a major challenge, right? Because the natural language text is unstructured and very uncertain, right?
Whoops.
When you're late, if you try and sneak in, I'm so sorry. I'm no good at the cinema.
And this fourth point is really about computer scientists. So I'm a computer scientist, and one of the challenges for me is just accessing the world of healthcare experts. Like, we're in our own school, and just finding a health expert that is interested in data visualization is quite a challenge for us, actually. So that's one of the reasons I'm here, right? Now, this is just going to be so it's a 15-minute slot, right? So I'm just going to give an example of a project we worked on related to Health Viz. It's called LetterViz, a letter space view of clinic letters. I don't expect everybody to understand all the details, but it's just to give you an idea of a sample of what we've worked on, right? This is one example. And I have a demonstration video that I play after this slide. So it's a novel visualization tool that leverages natural language processing techniques to support the exploration of unstructured clinical text in a structured manner. So this is an example of a clinic letter. So imagine you have hundreds or thousands of these letters, and you want to extract patterns or outliers or trends from them, right? The standard approach would be to get out the letter, read it, try to take notes, and look for patterns manually, right? And then the question becomes, can we design some visual interface that lets us do this in a semi-automatic way and in a systematic and objective way? Can we find patterns, trends, outliers, and those sorts of things? And in this case, the focus is on prescription drugs. So we built this visual interface for analysts, electronic health records analysts, but they really want to study the patterns of prescription drugs given to epileptic patients. So it's a special set of patients suffering from epilepsy, right? So we developed this visual interface to identify and verify patterns and outliers in a cohort of epileptic patients. And we'll have a special focus on the comparison of anti-epileptic drugs and co-prescriptions through what we call multiple coordinated visual layouts. And then we have some case studies in the actual research paper about this. So the analysts, the health data analysts in this case, are looking for patterns of drug prescriptions that coincide in the same letter. And they're looking for good patterns and bad patterns. Like there are some drugs that should not be given to, for example, to pregnant women, right? And they're looking for outlier behavior like this, right? So I'm going to show a little demo video.
What was the hypothesis then that this is testing? Or was that going to
That's a good question. That's a very good question. So the hypothesis, one of the hypotheses is that if we create something we call a letter space, so that's this space right here, a letter space, an average letter space, and then we superimpose all the letters on top of each other into one single unified letter space, that will help us extract patterns. And then we visualize the drug content of those letters. It will help us explore them, see the patterns, and see the outliers. So the hypothesis is there's a helpful implicit knowledge inside the letter space itself that we can try to exploit. That's one of the underlying hypotheses. Yeah. And we'll try to demonstrate that, actually. So for the video, I have to turn the sound. There is sound for the video. There's a voiceover, but right now I'll use my own voice. And there's a copy of this on YouTube as well. So if anybody wants to see it on YouTube. So we have this visual interface, and it's divided into different parts. This is a query interface. So the user can insert anything they're looking for in this interface, right? We've done some very generic extractions, like we can depict phone numbers in the letters, postcodes, hospitals, dates of birth, and so on. And then there's a special category of drugs, prescription drugs. And the user can search for their own prescription drugs, like these two, for example. These are two that are very commonly prescribed together, right? So they can search for whatever they want in the letter space. It's usually prescription drugs, and then they get different visual results back. This is the so-called matrix view, and it shows all the prescription drugs, or the most frequent prescription drugs found in the letters, ordered by popularity. So the ones in the top corner, to top left, are the most popular ones found in the letters. And then where there's a colored box, it means this drug pair is found together in the same letter, right? And so these are the two most popular drug pairs found in the letters. This is the so-called drug chain view. Each row in this view represents a single clinic letter, and then each cell in each row represents a prescription drug that's been identified. And now the colored ones correspond to the search queries. So these two drugs are found together in the first letter, for example. And right away we get an overview of the most frequently prescribed, co-prescribed drugs, right? And we get also an overview of ones that are never co-prescribed, by the way. And then we get an overview of the order in which they're found in the letters, right? Here we have a very unusual letter, right, with somebody that's has a lot of prescription drugs, for example, mentioned in their letter. So an analyst might see this kind of strange letter and then actually click on this row and see the original, right? The original letter. So the original letter appears down here, or the original details. So that's the appearance of one of the prescription drugs, another one, and another one. And these colors are all consistent, by the way. They're all supposed to be consistent. And here is the letter space view with all the letters superimposed on top of one another. And then we compute a centroid of the position of those drugs. So this is a little bit of a close-up view of each of those views because it was so hard to read in the zoomed out view. So here the user has input 3 different drugs, right? And then they're looking for the combinations of these drugs in the letter space data, right? Here is one of them, and here is another one. And so this drug, I can't even pronounce it, lamotrigine, appears in combination with a lot of other prescription drugs. This is the letter space view, so this is the centroid that computes the position of all the center point, the average position of all the drugs that correspond to this one, which I can't pronounce, levetiracetam. Anybody familiar with the? Yeah. Now, these are the appearance of these co-prescriptions in the individual letters, so they're represented by a thumbnail view. So this is the global view superimposed, all the letters into one space. This is the thumbnail view, the appearance of those co-prescriptions in the individual letters, right? So, and this is the centroid of the appearance, right? If the user clicks on the centroid, then they see the instances of appearing in the individual letters as a graph. Right? And then if they click on an actual thumbnail, then it brings up the so-called focus view, which shows every line in the letter that they're looking for. Right? They've done some searching, and now they've found what they're looking for, and this shows the lines in the letter. They can then click on the view document, if they like, as another one that shows the original letter. Right? Now these are 2 health data analysts giving feedback and giving their reaction to the system. So that's part of what we do is we want to actually work with what we call domain experts and get their feedback, right? And so one of the domain experts has identified an interesting letter and they want to look at the patterns in more detail. Like, for example, this one has quite a lot of features and characteristics in it, right? And like I said, one of the patterns they're looking for is this combination of the wrong prescription drugs. So they might search, for example, pregnancy plus the prescription drug, a particular prescription drug of interest. We use this rendering technique called focus and context. So the focus just means everything that you're interested in appears colored. It has a color assigned to it. And everything else is in grayscale, and that serves as a context. So instead of just looking at the focus, we provide the context in which the focus appears, right? This is the user interacting with the matrix view, so they want to know how often this combination of drugs actually appears in the data. So there are 36 clinic letters in this particular data set that have that combination of drugs. So this is the kind of information that they get when they hover their mouse over the matrix view. And if the user chooses one of these combinations, all of the other views will update to show the focus, so to speak. So these are some more drug combinations that the users are searching for. And these are the domain experts giving some feedback on our demonstration. Like we're demonstrating the software to them and trying to get their feedback. Things like we ask them if it's useful, we ask them if it helps them analyze the data, right? We might ask them for what they suggest for improvements, right, and those sorts of things. Okay, so the full video is online if anybody wants to see it. Also, I can play the rest during the discussion period if anybody has more questions or queries.
Is this a hypothetical case because you've got patient details on the letter?
These are not, well, they're synthetic, like they've been anonymized, the letters, and they're a combination of real and synthetic data. So that they're synthetic enough that the original patients can't be identified.
That's what I was going to guess. I just
Yeah,
wondered on
yeah.
YouTube then.
This is also one of the challenges that I didn't mention in the challenges section, is just accessing health data, right? It's a major challenge because of privacy and the privacy and security concerns.
Great, thank you. Can you, have you got some more?
Yeah, I just wanted to mention that we have other projects in visualization for health, like population health records. We have a geospatial visualization project that we worked on. We have a state-of-the-art report on electronic health records visualization, and we're currently looking at visualization of blood glucose levels for diabetes patients. So those are some of the other things we're working on. Okay, I'll wrap it up in the interest of keeping with the timetable.
You've got some questions from online.
Oh, maybe, do you want
Should
to
I
stop
switch?
sharing and then we can see everyone? Or Sonia?
There's two in the chat.
I was going to say, it's got to be Sonia.
I should look at the chat, I guess, to see. Okay, could you pop the link to the video in the chat? What's the best way to do this? I guess,
So it can be done offline if you want to move on with the other questions. You can always do it a little bit later on.
yeah, if you go to YouTube and you put letter viz in the search, you should find the letter viz video. Yeah.
Steph's done it. Okay.
There we go. Somebody found it. Very good. Thank you very much, Stephanie. I appreciate that. Particularly okay, yep. How is the global view produced? So the global view produced is, first we create what we call a letter space, which is, it's trying to create like the average width and the average height of all the letters and the average number of characters that appears on each line, because all the letters are different actually. So we're trying to create some sort of average letter space. And then we actually extract all of the text, so all the text is digitized, and then we run some natural language processing to extract a lot of metadata, like all that metadata you saw, like the dates of birth, the dates of the letter, the prescription drug names, any numbers, we extract any numbers, units, like units of drugs, and so on. So all that is extracted, and then a position is computed in the letter space for all of that metadata, and then it's superimposed into one.
So is it essentially the average two-dimensional spot on the page that term would be found? Is that yeah?
Yeah, yes, there's an average position, and then there's an actual position for the individual letters. So we have both.
So you could, for instance, if lamotrigine is mentioned once, it would just be once on that letter, but you could search for the times when, maybe you're struggling with lamotrigine, it's mentioned 7 or 8 or 9 times, or you're introducing it. You can see how that evolves over time for individual patients at scale. Would that be sort of
Yes,
a utility
yes,
of
that's
it?
one of the things you could do, yeah, yeah.
Shall we
Sorry.
let Sonia ask a question? Because
Thank you.
she's very into this area.
Okay. Can you hear me okay?
Yes, can
Yes.
you hear me fine?
Thank you. Yeah, thank you, Robert. It was really interesting because I work with the clinical practice research data link, and I'm very interested in pharmacoepidemiology studies. And we're currently looking at association between drug use and a serious rare skin condition called bullous pemphigoid, and we've looked at prescriptions. So my first question was, I couldn't understand what the advantage of looking at letters is compared to using, if we've got electronic prescription, they've got the data there, what advantage is there to looking at the letters?
Well, I guess the letters are one of the challenges faced by the health data analysts. So they have thousands of letters. And they said, they basically just asked the question, is there a way that we can visually explore and analyze these letters? We have them. We want to look for the drug patterns of drugs in them. Can you help us do that? That was the basic premise. And so, yeah, I wouldn't say that the letters are a replacement for any other methodology. They're more like a complementary perspective, let's say, on the prescription drug data, rather than some substitute or better way than some other traditional technique.
Okay. So would it be interesting to compare the two, like do validation, maybe do what you're doing with the letters, and then do what we're doing with prescriptions and see if we get the same answer?
Exactly.
Like that. Yeah.
I think
Okay.
from so I'm a pharmacist, I used to work in GP practices, and part of the work we do was medicines reconciliation. So what necessarily got reported in the patient letters wasn't always what the GP prescribed. So I guess there's that kind of approach that would be interesting to see the differences there. So Natasha said, there seems to be a mixture of generic and brand names. I know that staying on the same brand is important when using anticonvulsants. I'm just wondering if the variability in the way the prescribing physician refers to the medication prescribes causes added complexity. Yeah.
Yes, it does add complexity, the different names, because that's correct. The different drugs can be referred to in different ways. So the same drug can be referred to in different ways. And that's going to be up to the health data analysts to recognize that and address that. So they might have to run a query that involves multiple names of the same drug. It's possible. Yeah.
I'd imagine it's a bit like database searching. You know that epilin is also sodium valproate. I can't remember what it is now, but you could have epilin or sodium valproate or
Yeah. Just more data cleaning, basically.
Yeah.
Paul, have you got a question?
So Bob, that's really, really fascinating. But one observation is that the data you're using, although in your intro you sort of flagged that, this sort of communication is sort of unstructured and inconsistent and varied and stuff. I guess what I see when I see those letters is they are really quite structured and similar in outline and stuff. And one of the areas where I would think about something like this is when we send out surveys to participants in our trials and stuff, and we often give them a free text box.
Mm-hmm.
And actually, they're much more varied than sort of the clinical letters. But actually, how we engage with those free text boxes is something of a challenge. And moving from something which is so unstructured to something which is a bit more an objective assessment of is quite challenging. And I wondered how your software might respond to something which isn't as consistent or structured as a letter, but some people might give you 10 words, some people might give you 10 pages. How would it deal with that?
Yeah. So yes, this system is really, really specific. It's really targeting this clinic letter space. So it wasn't designed with a completely unstructured text in mind. So if we were dealing with completely unstructured text, I would probably go back to the drawing board, so to speak. So the drawing board always starts with an initial conversation that says, okay, what data do you have? Why did you collect the data? And what are you hoping to learn from the data? Those are the three starting points. And then what would you like to extract? And once we have those as the starting point, we'll start to suggest some visual interfaces that might help either resolve problems, address challenges, or help answer those fundamental questions. Yeah.
So what would you say, like what kind of structured data works best with this kind of thing? So I can imagine, sorry Paul.
Can I follow up actually, because it's really interesting, because actually I've done this a few times, something similar. We've had free text responses in a number of different clinical areas in surveys,
Yes.
and none of it lends itself to a classic qualitative thematic analysis, which is entirely subjective. So one of the things I did a few years ago is try to create a multi-stage approach where the first stage is content analysis, is simply counting the recurrence of words or phrases. And the last stage is something which looks like a thematic analysis, entirely subjective. But there's a jump in the middle of something called keywords in context, where you're trying to connect words. And in my way of doing it, that is a bit more subjective, but it feels to me that you might have the tools to make that keywords in context a much more objective process.
Yeah. This is the visualization of natural language is really challenging, and there has been quite a lot of work done in this area, and we have done other work that's not related to health in just the visualization of natural language texts. So, for example, we worked on a project that was visualizing translations of Shakespeare's Othello into German. So, for example, if we have two translations of Shakespeare's Othello into German and they're differing, how can we compare them? Is there a way we can visually compare them with each other? And how can we identify passages that have wildly different translations and ones with very stable translations, for example? So that's a project we worked on, and I can give a talk on that. Or there's already a talk on that on my YouTube channel. Another project we worked on we call visible natural language processing, which adds a visualization component for every processing stage that the natural language goes through before you see the output. So you can have control over the actual natural language processing parameters, and then see the pipeline, the processing pipeline that it goes through before the final product is revealed, so to speak. So that's a longer conversation. Like there's no quick one sentence answer I can give you for that question, if you know what I mean. It's a longer conversation, I think. What visualization techniques apply to unstructured texts, right? That's a huge question with lots of different possibilities.
And maybe I'll get in touch. I mean, because we're often pushed to put in free text responses to these sort of standard measures which are being collected from lots of people. And of course, I either wax between feeling this is so exciting, we've got data from lots of people, or thinking it's so inconsistent and almost impossible to handle. So maybe a conversation would be good.
Yeah. I'm definitely open to a conversation. In fact, I'm always thinking about ideas for bids, like what are the open research challenges related to health that I can include in my next bid. And we also have collaborative projects in visualization that involve undergraduates, master's students, and PhD students, for example. Yeah.
I was wondering about the MedSci projects, but I think they're about to stop. I'll email you, Bob, because this is something I've been thinking about for a while. Sure. I didn't quite know where to go with it.
Yep.
I just have a comment. So Paul's statement regarding the clinic letters that talks about being more similar than he thought they would be compared to free text comments. I would argue, and I think that clinic letters vary wildly unless someone is using a template, and between specialties and then between trusts and between countries, clinic letters will be completely differing. And if a template is used, it's usually got the set bits and bobs and then free text bits at the bottom. And I struggle to see a little bit what you use this data for. It's a completely new concept to me. I don't really see where you're going with these data, but I could envisage that knowing what you know from all the letters that you've seen, you could sort of propose the ideal clinic letter template that would help potential research, as you were discussing earlier, between differences between clinic letters and what is prescribed in general practice and what you see on the pharmacy database. I could see that the ideal clinic template letter for different specialties that could be used to standardise across the country could be quite a useful output for this kind of work.
Yeah, that's a really good point. That's a really good point. One of the things I could bring up is, I think for me, one of the big challenges is how do you get an overview of that data? If you have hundreds or thousands of these letters, is there a way to get an overview of what's in those letters? And that's one of the things that the letter viz provides, is you have a superimposed overview. You have a starting point. You can say, I have this drug I'm interested in, I want to see everywhere it appears, and I want to see that in one image within 1 second, or a sub-second. It's a little bit scalable. It's not infinitely scalable, but you can apply it to hundreds or thousands of letters. This is one of the challenges that we're always thinking about in the back of our mind, is how do you generate an overview of the data as a starting point? Because if you think carefully, everybody wants an overview to start with before they apply their filtering and selection and subset selection techniques, and they drill down into the details. Yeah. This is one of the things that the visualization people work on.
I could imagine it being useful to see how things are introduced to the market and spread throughout practice.
That would be another extension. That could be another extension. Is it like a time-oriented view that shows the evolution of some prescription drug over time, or adds a time dimension to the letters? Because right now there's no. We extract the time and the date, but we don't have a time-oriented perspective on them. So in this particular case.
Sonia might be able to say a bit more, but there are quite a lot of studies in CPRD where they look at different combinations of drugs and how long things have been introduced into the market and that kind of thing. Yeah, Sonia?
Yeah, thank you, Jane. Yeah, we're actually doing some work with Grozella, Robert. I don't know if you know Grozella, Figueredo.
Yes.
So we're looking at using associational mining, where we're looking at different combinations of drugs and see whether the certain combinations are more likely to trigger a skin disease. But yeah, I'm just thinking maybe my suggestion would be just to, because we've got access prescription data, whether it's be worth better use of your time looking at letters maybe on data that we don't have electronic access to. Does that make sense? That's my sort of where I'm coming from, because I feel you can answer your question with the data we already have, probably. So maybe the other information in letters that we don't have in the CPRD, which would be really useful. That's my honest opinion.
So what type of thing is that then, Sonia? It's more like where the data is not so good in CPRD. Where would you say that?
Yes, so lifestyle, things like diet. That sort of information, because we don't actually, Robert, we don't have access to free text in CPRD also, so anything that GPs would put in the free text as well. So not a firm diagnosis or not an electronic prescription. So there's definitely a gap, I think, which your method could fill.
Brilliant. And Kim's and Steph have commented. Steph says, I think the hypothesis would still be key.
That's right. Yeah. How what we develop depends on those initial set of questions that we always ask, like why did you collect the data? What are you hoping to learn from the data, and what questions are you trying to answer, and what hypotheses are you trying to confirm or refute? So that's the starting point for all of it, and then we discuss different possible solutions to those questions and hypotheses.
Yeah, and finally Kim refers to speaking to Tony Avery on drug safety.
There's the Primis group as well, isn't there? They're a data team.
What is the CPRD?
Clinical Practice Research Data Link, Sonia. So that's like a you can explain, Sonia.
No, you can, Jane.
So it's basically just a big database of GP records that you can that I think you pay to access, don't you? And in there there's just like prescription data, what people are prescribed, some diagnosis data, but it's all very much depends on what the GP records, and that's determined by a lot of different factors. But I think what Sonia said is really interesting, that there could be a whole source of information that the GP doesn't necessarily record that really would inform certain research questions that could be used in this technique. So any further questions, or we could draw to a close?
It's good to see an audience that has some interest in visualization.
Sorry, I don't know whether anyone mentioned, I was looking at the messages on Teams actually at the moment. Kyle and Alex, who are the top all digital fellows in dermatology, would be interested in your work, I'm sure.
That's great. That's really good. Yeah, I'm guessing that everybody has a very large data set that they're struggling with, that they're trying to understand and get the most value out of, trying to find the patterns and the trends and the outliers and those sorts of things.
If you've got a sort of like a paragraph précis of what you do and the sort of work that you're interested in and the sort of person or clinician that you would like to engage with, I can forward it to those two I mentioned and see if we can get a dialogue going.
Yeah, for sure.
Yeah, just two final questions in comments. Steph saying again that the novel bit of this whole technology is the letter mining bit, so that you get a data set to analyse from the letters. And Natasha says, I agree with Sonia, lots of hospital letters over the years, and they do have data beyond, yeah, definitely. And it's not currently being mined, but could be valuable. So very exciting opportunities, definitely. Never thought of doing that. Okay, thank you everyone online. Nice to see you all.
Thanks everybody for joining. I appreciate that.
Great. Bye-bye.
It would be a fun exercise just to count the number of letters in existence. Just in England.
NUH are about 300,000 behind in their typing from the last month, so.
Oh gosh.
Yeah.
Wow! So it's 200,000 to 300,000 per month, like something like
It's
that?
over a few, I don't know.
Yeah.
Yeah, my letters are taking about a month and a half.
I mean, there are about 2 million outpatient appointments in NUH per year.
Wow.
Median of
Not a huge trust.
median of 1.2 letters per clinic.
Reasonable size, but yeah, there's bigger.
Yeah.
Yeah.
Right.